Hi, I'm Ashley. I'm doing my informative speech on diabetes. Okay. Diabetes is a growing problem in the United States. There are three different types of diabetes: type 1, type 2, and gestational diabetes. In 2012, according to the Centers for Disease Control, 29.1 million Americans have had diabetes. That's about 1 out of 11 people, and it's about 9.3% of the US population. Of those millions of people with diabetes, only 21 million were actually diagnosed. So that means 8.1 million Americans went undiagnosed. That's about 1 in every 4 people that have the disease that don't know they have it. That means they're not being properly treated or educated about the disease. Diabetes is also the seventh leading cause of death, and that 234,051 death certificates were listed diabetes as an underlying or contributing cause of death. This number could be reduced if more people had better understanding of how to manage the disease properly with healthy eating, daily exercise, physical activity, and in some cases, medications to help lower the blood sugar or blood glucose levels. Um, let's start by, let me start by kind of talking about each type of diabetes. So type 1 diabetes was previously known as insulin dependent or juvenile diabetes. It's commonly diagnosed in children and young adults. It accounts for about 5% of diagnosed cases of diabetes. This type of diabetes occurs when the beta cells, or the cells that the pancreas pancreas has that produce insulin, they're destroyed. The cell destruction is started in the body's immune system, and it limits or eliminates the production of and secretion of insulin, which is the hormone required for the body that are required to lower blood glucose levels in the body. There's no known way to prevent type 1 diabetes. People with this type of diabetes have to be on insulin therapy, whether it be by pump or injection. They have to be on insulin therapy to survive. It's also very important for people with type 1 diabetes to follow recommended nutritional guidelines for diabetes and incorporate exercise into their daily routines. It'll help reduce the risk of chronic highs and lows in their blood sugar levels. Anyone diagnosed with type 1 diabetes should consult with a physician to find out the best way for them to manage the disease, because everybody is different. So what works for one person may not work for the other person. Type 2 diabetes, also known as insulin resistant diabetes, is the most common form of diabetes. It accounts for about 90 to 95% of all diagnosed cases. This type of diabetes is when a person has this type of diabetes, that means their body is not using the insulin that they make properly. The body is not using it properly. This primarily occurs in the cells of the muscles, the liver, and fat tissue. In the beginning, the pancreas produces extra insulin to make up for the high demand. But then, after a while, the pancreas gets worn out and the workload is too much, so it won't produce enough that the body needs. It's just unable to keep up with the demand of the body, so you won't be able to maintain a normal glucose level. Type 2 diabetes can be treated with a diabetic diet, daily physical activity, oral medication, and in some cases, insulin. Some people can control their diabetes or blood sugar, excuse me, by simply eating healthy and being active. Those are two big things for any diabetic. And others can't control it with just the eating and the diet and the exercise. They would need prescribed oral medications or insulin, and that would come from, obviously, that would come from their physician. Um, Generally, type 2 diabetes gets worse over time. So if you start out not needing medication, in the long run, chances are you at some point will need the oral medication or insulin. Um, Old age, obesity, family history of diabetes, history of gestational diabetes, which I'll talk about later, impaired glucose metabolism, physical inactivity, and race or ethnicities are all risk factors for getting diabetes. People with diabetes and their families should try to learn as much as possible about the latest medical therapies and approaches in controlling their and managing their blood glucose levels. Um, I'm sorry, I got lost. Before you start on any type of nutritional or diet regimen or activity or exercise plan, it's important for a person with type 2 diabetes to also consult their physician first. It's a matter of balancing their diet and exercise plan together, to work together instead of against each other. Because if this person, let's say, doesn't eat breakfast and then they go and run a few miles, chances are their blood sugar is going to plummet and they're going to have go into a diabetic crisis. So it's very important to consult for this person to consult their physician and get more information and what's going to work for them. The last type of diabetes I'm going to talk about is gestational diabetes. This type of diabetes is basically a glucose intolerance in pregnant women. It's normally diagnosed in the second or third trimester. Gestational diabetes is when the body isn't able to make enough insulin to keep up with the pregnancy. It causes an increase in blood glucose levels during the pregnancy, and an increase in those that blood glucose level could be very harmful to the mother and the baby. And it requires treatment to control, just like type 1 and type 2 diabetes. The risk factors for gestational diabetes are very similar to the ones of the type 2 diabetes. Most treatment plans include a healthy diet, regular physical activity, and or insulin, just like type 2 diabetes and type 1. And not long after pregnancy, 5 to 10% of women that have gestational diabetes still have problems controlling their blood glucose and end up being diagnosed with type 2 diabetes. So it's very important for a pregnant woman to keep her regular appointments with her obstetrician so that they can get those labs and control those levels before it becomes a problem. And as well, and just like in type 1 and type 2, it's very important for the pregnant mother to consult with the doctor before you doing any kind of diet or exercise. Now, although the three types of diabetes are very different, there are two things that remain the same, and that's diet and exercise. There are many types of healthy eating plans for diabetics. The plate method, carb counting, glycemic index. But in general, a diabetic's plate should consist of about 25% protein, 25% grains and starchy foods, and 50% of non-starchy vegetables. You can also add a serving of fruit and a serving of dairy, or both, if your doctor approves of that type of diet. And to complete the meal, you need a low-calorie drink like water, coffee, or unsweetened tea. Um, let's see. Adding physical activity to your routine is just as important as your diet. It is recommended by the American Diabetic Association that a person with diabetes does five 5 days, 30-minute sessions of aerobic exercise, and 2 of those days they need to add in strength training. And before starting any diet or fitness program, it's important, as always, to consult your physician and make sure that that is what's going to be working for you. Diabetes is a growing problem in the United States. It will continue to be an issue with the yearly diagnosis of 1.4 million Americans. I am hopeful that with the sharing of education on the treatment and management of this disease, people will get the help they need and we can reduce the number of deaths each year.